Hi everyone, it's Nick with Kentucky Spin, back with another youth talk. For this youth talk, I'm going to go over the My Healthcare Plan resource. So the My Healthcare Plan infographic has five kind of like little topics and just things to keep in mind when trying to better take care of your health. And I'm just going to kind of go over these five things pretty briefly and give a little bit of detail covering them. So the first topic is communication. You want to really get comfortable when you want to take care of your health. You want to get comfortable being able to talk with your doctor, especially when you're transitioning to adulthood. Because when you're younger, your parents or guardians would have had a very active role in managing your health when it comes to like your insurance, and it would probably in most cases make your appointments for you, talk to your doctors for you. So as you're getting ready to transition into adulthood, or even if you're in adulthood now, you want to start practice talking with your doctor on your own without anyone else doing it for you if you're able to. This doesn't have to be anything super in depth. It's just you want to get comfortable, especially if you have a consistent doctor that you've been seeing for some time now. You really want to work on getting comfortable talking and interacting with them. The second point is knowledge. We mentioned knowledge. You want to understand your disability and diagnosis, know your medications, what you take those medications for specifically, and be aware of any allergies that you have, as well as how those allergies affect you and what they do. Third point is research. Once you turn 18, your doctors or psychiatrists or whoever your healthcare providers are that you were seeing as a youth might not be available for you anymore. They might just be child specific doctors, like they might only work with youth, people under 18. So, something to keep in mind as you start getting ready to, as you start to age up and you turn 18, is that you and your guardians or parents might need to start looking for a new healthcare provider because there's a good possibility that you will not be covered under your previous healthcare provider as an adult. Um, I know me. I when I turned 18, I had to basically completely get um, a new doctor. It wasn't that big of a concern for me because basically when I turned 18, I was just introduced to our family doctor. So I just started seeing the same doctor that my mom and dad see. Whereas before that, I had my own doctor. I had a local doctor I went to, and I had a local psychiatrist that I would go to. But once I turned 18, that completely changed. But I was fortunate to be introduced to our family doctor, the same doctor my parents have. And that made that transition a lot easier for me. That will probably be the best option for you if your parents already have a doctor that they see it that they like. That'll probably be the easiest way, but you also have to keep in mind things like insurance, if your insurance is covered by them or not. There's a lot of information that you'll need to look into when it comes to insurance and available doctors, all that stuff to kind of figure out where to take your health care once you turn 18. Fourth point is to create an emergency medical plan. What that means is have some kind of physical form or document that kind of goes over all of your healthcare concerns. Like if you have certain, it would have like your disabilities on it, certain diagnoses, if there's like again medications you take and allergies you have, how different medications affect you, and kind of how to treat you or what you need to do in the event that you have an emergency, like who you need to call, but basically it's a document that contains all the information that you need in the event of you having a medical emergency. It has all the stuff that you can either give to a doctor or a first responder, or has the steps that you yourself need to take in the event that you have a medical emergency so that you can get yourself taken care of appropriately and efficiently. And for the last point, write down your family medical history. This is really important because you need to know, even if you aren't necessarily affected by certain medical conditions, if you have a family history of it, like if on like your mother's side you have like a history of heart disease and things like that, even though you might not show any symptoms of it yourself, or if like on one side of your parents you might have like a history of having diabetics in your family, even if you like don't show symptoms of having diabetes or heart disease or anything like that, you still want to be aware of those and have evidence of them. So that way, when you do go see a new doctor, if you have to change your doctor due to insurance or due to you moving or for whatever reason, you can have that document. You know your family's medical history. Because again, even if you might not have the same things that your parents might have or that your grandparents had, etc., it's still because of genetics and all out those things. It's still good to be aware that those are developments that have happened in your family's history. So that way, when you go to the doctor and you have to set up that new health insurance, or you have to go meet that new doctor because you move or whatever reason, they can look and they can be like, okay, well, you might not have these conditions, but I can see that your mother had this, and your mother's mother had this, and your mother's grandmother had this, etc. So they can start looking, and they know to when they treat you, they can start looking for those signs. And if you do develop those, hopefully they can catch those they can catch those earlier, so that the way you can be treated for them before they get out of hand for whatever reason. So it's really important to have a record of your family medical history because again, even if it doesn't affect you, if it's something that your parents had or that your grandparents have had, it can possibly affect you later down the road. So it's just good to be aware of those now. So that way, when they do come up, your doctor or healthcare provider will be aware of it and they can better treat you and hopefully catch it earlier if it does come up. But that's all I have for this youth talk. Just wanted to have a brief little talk going over the My Healthcare Plan infographic that you can find on our website, on the Kentucky Spin website. It's just a short little thing. It has the 5 points that I mentioned with a little explanation for each one. I just wanted to do a short video kind of going over each point in a little more detail, and as well as give some advice. So yeah, again, that's all I have for this youth talk, and thank you for watching.